Hi everybody, hello and welcome. Thank you for tuning in. I'm Dr. Smart with Smart Skin Dermatology, and we are talking about Vbeam Laser. Now, the Vbeam Laser is a pulsed dye laser, which means it has a wavelength that is set to target blood vessels. The ideal candidate for a Vbeam laser treatment is someone who has red spots that they would rather not have. So red blood vessels, most of the time these are on the face. Cherry angiomas, broken capillaries, telangiectasias, vascular birthmarks, and rosacea. All of those things are the more common, but it can be used to treat scarring. Again, the redness component of the scarring. So think of it as a red spot laser improver, a laser that improves red spots. Certain types of red spots, like spider angiomas or certain types of blood vessel growths, will respond really well with one laser treatment. But most of the time, people who are doing a Vbeam laser treatment are decreasing the amount of redness on their skin. So the laser itself feels like a hard thwack, like a sharp hot rubber band thwack each zap, and it goes up and down back like this. And that laser energy specifically targets the blood vessels to induce as much damage as possible to the blood vessels and as little damage as possible to the skin around it. Most of the time after a pulse dye treatment, most people look a little bit red, kind of like I would probably now after flicking myself a few times. Sometimes there's some bruising. Bruising is very common. If there's bruising, then that's fairly noticeable for the week. If there's not bruising, then you look pretty normal in a day or two. A little bit of swelling is very common as well. You look a little bit swollen usually for a day or two, depending on what zone's being treated. And some people, along with the easy bruisers, will be big swellers and they'll look a little swollen and a little bruised for most of the week. But like I said, the ideal candidate is somebody who has red spots, and that sometimes is redness or flushing. Sometimes it's visible, tiny little broken blood vessels, but red spots on the skin that they like to lessen. And as I mentioned, most of the time people are doing a series or a course of this, somewhere between 2 to 4 treatments once a month, monthly for 2 to 4 months to bring down the redness, with the exception of certain blood vessel growths that actually respond really well with just one laser treatment. So, if you happen to be one of these people that has red spots that they'd rather not have, then the pulse dye or Vbeam laser is the treatment for you.